I'm here to do a refutation speech on stem cell therapies and its ethical issues. My opponent Alex's main claim was that stem cell therapy can be used to treat many medical issues such as disaster and trauma victims and infertility. However, ethical issues have arisen over the harvesting of embryonic stem cells. As he explained in his speech, embryonic stem cell therapy is the biological research of stem cells derived from embryos and then the medicines they're used in. My claims are that the reason there are ethical issues is because of the use of aborted fetuses and the negative side effects of stem cell therapy and how stem cell therapy can cause infertility. My opponent's first point was that there are many ethical issues that come from harvesting of embryonic stem cells. This is true because Life News says that 60% of people in the United States are against abortion. However, he states that embryonic stem cells cannot and do not come from aborted fetuses. Yet, according to National Conference of State Legislators, 17 out of the 33 states listed allow the harvesting of embryonic stem cells from aborted fetuses, proving that indeed come from aborted fetuses. My opponent's second point was that stem cell research could serve to better treat disaster and trauma victims. When Alex talked about one of his examples of a man who started to have improved motor skills after being paralyzed for 16 years, he failed to mention all of the negative side effects that one might experience from after stem cell research. These trauma victims could include cancer patients as well. According to Women's Health, cancer patients who have undergone chemotherapy also have received stem cell therapy. Many experience short-term side effects, for instance, a change in their eating and appetite. There's a very high risk of infection, anemia, which is a disease that the amount of red blood cells decreases in one's system, bleeding and bruising, veno-occlusive disease, which affects the liver and can sometimes be fatal. Interstitial pneumonia syndrome occurs when a high dose of chemotherapy results in the damage to lungs and can occur at any time following a stem cell transplant. Graft failure is when the stem cell graft fails to grow following a stem cell transplant, resulting in bone marrow failure. Graft versus host disease is when the body recognizes the transplant stem cell as a foreign substance and begins to attack and destroy these new cells. Some long-term side effects also include cataracts, which is a decrease in vision or even blindness, and some patients can even develop secondary cancers, and so for some women this means breast cancer, and infertility, which leads to my opponent's next claim that stem cell therapy can help with infertility. My opponent's claim is that stem cell therapy can help with couples who are having troubles having kids. And Alex cites the U.S. Center of Disease Control and Prevention in Atlanta, saying that 10% of American women of childbearing age have trouble with getting and or staying pregnant, and that is more than 1/3 of infertile couples result from medical complications associated with the male partner. Women's Health says that in some cases infertility can happen as a result of stem cell transplant. Younger women are more likely to recover from the stem cell transplant than older women. And total sterility can occur in men when they're being treated with chemotherapy and the stem cell transplant. So in conclusion, embryonic stem cell research may not be as perfected as we thought. The ethical issues caused by the harvesting of embryonic stem cells are fair in the fact that testing is allowed on aborted fetuses. The stem cell research does not necessarily always benefit the trauma and disaster victims because of all the negative side effects that can occur. And the third supporting claim that embryonic stem cell therapy can help with infertility was proved wrong by the evidence from Women's Health saying that the stem cell transplant can actually cause infertility in men and women.
All right, you label the claim and secondary points, you define what embryonic stem cells are, you talk about the ethical issues first, you kind of accept this premise that there are ethical issues related to this. You do show that there is a general objection to abortion. The factual data that you present about the large number of states that allow the collection of stem cells from aborted fetuses, that's an interesting piece of factual data. I'm not sure how closely that parallels what the advocate was talking about on those issues and the inference that was being made, but I do think that you do point out that there is, in fact, a legitimate ethical issue here, although that is pulling us a little bit out of the factual disputes and into maybe a value argument, so you still want to be careful about it. On the second issue, basically you are talking about all the potential side effects that could occur from stem cell research, suggesting that those solutions are either premature at this point or they're not reliable. Your evidence is very generic in listing potential possible side effects, and there are a whole bunch of them, and I think that's the right thing to do, is to tell us what all those things are. But let's contrast this. If I'm worried about anemia or being able to walk again, I think I'll live with the anemia. I don't know that some of these other things are all that important in the context of where the stem cell research might be applied, and I think that you kind of are trying to get as much out of that generic information as you can without necessarily coming to grips with the advocate's evidence and challenging the inferences that they're drawing from that. I think you've got a good piece of information here, but I think it's allowing you to kind of ignore the argument on the other side, and you need to come to grips with that more firmly. On the issue of infertility, you're kind of trying to turn it around and make it work the opposite direction, and that's largely due to some of the evidence that you had on that earlier point that's generic about the impact it could have on fertility for people who undergo stem cell therapies. And, it's okay. It's a reasonable challenge to make there. Again, I think that there are probably arguments from the advocate that could be directed more directly advanced, talking about their evidence and their reasoning as well as your counterclaims, kind of relying on the counterclaims to do the work for you here.